I rise today also to speak about the debate before the Congress right now, which is health care reform. And I want to say that I believe we need health reform in this country and health insurance reform in this country, and would love to see us embark on a set of time-tested, budget-neutral principles. I absolutely believe that we ought to address the issue of pre-existing conditions. I absolutely believe that we ought to look at exchanges where citizens all across this country have access to the same kind of choices that I have as a United States Senator. I hope we'll address the issue of cross-state competition, where people in states are not just stuck into the choices that exist because of monopolies that occur within their state boundaries, but I'd love to see some cross-state competition. Mr. President, I absolutely believe that we ought to have tax code changes. I think we ought to limit the amount of tax-free benefits that an individual can receive from their employer. I'll just throw out a number. If that number were established at $17,000, for instance, about $350 billion would be generated over a 10-year period that could be used as a voucher or refundable tax credit to enable 15 to 20 million Americans to be able to access private, affordable, quality insurance. I think we ought to address tort reform. We know that there's so much in the way of medical procedures that are done, in essence, to be defensive medicine so that they're not sued or the victims of junk lawsuits. So, Mr. President, I want to say that I'm one of those people that absolutely believes that it's time in this country that we had certain health reforms and health insurance reforms, and I think now's the time to debate and put in place those sensible, time-tested reforms. My guess is, Mr. President, if we sat down in a bipartisan way, which I know is not occurring at this moment, that we could go 50 yards down the field in a way to really create access for Americans in our country that all of us want to see, and again, do so in a way that doesn't push off cost into future generations. But, Mr. President, I have serious problems with what is being discussed in the Finance Committee today as far as how we're going to pay for the many reforms that go beyond what I just discussed, in many cases very unnecessary. And let me just go over a couple of those. Number one, I think most people are aware by now that the Senate Finance Committee's mark is basically causing states to have an unfunded liability. The governor of our state, who's on the other side of the aisle, just sent me a letter yesterday and told me that he expects the revenues in the state of Tennessee to be at 2008 levels in the year 2013. In other words, there's been a tremendous decrease in revenues for state government. And yet, per the mark that is before the Finance Committee today, they are pushing off on the citizens of our state a $735 million unfunded liability. Now, that doesn't sound like a lot of money here in Washington, but I can assure you it's a lot of money for the state of Tennessee. And as you can imagine, as the years go out, that number increases tremendously. Mr. President, it's my belief that there are states all across this country that are going to be coming to us asking why we're pushing off an issue to the state. I think that's incredibly irresponsible. And I think we need to ensure that that does not occur. But, Mr. President, I have to tell you, an issue that I have an even greater problem with is the fact that we all know that we have a $40 trillion unfunded liability as it relates to Medicare. 2 or 3 years ago, there was broad consensus on a bipartisan basis that we needed to address the unfunded liability that threatens our country under the entitlement programs, mostly Medicare, which is $40 trillion. What this bill does is it takes $400 to $500 billion from Medicare and uses it to create a whole new entitlement. Instead of doing those things that would strengthen Medicare, which the trustees have said is going to be insolvent in the year 2017, instead of doing that, which is the responsible thing for us to be focused on today, this Finance Committee, Mark, would take money from a program that is insolvent and use it to leverage a new entitlement program. Mr. President, I think that is the most irresponsible, short-sighted thing that this Congress can do. In addition to that, Mr. President, it doesn't even deal with the issue of SGR or the doc fix. I think all of us know that for physicians and providers who serve our seniors today, to make the same money in 10 years that they're making today would cost $285 billion. But instead of dealing with that issue, the can is being kicked down the road, and we're not dealing with that. Mr. President, I think the American people respect, and I respect, the people who came before us that are called the greatest generation. Sometimes they're called the greatest generation because of the sacrifices, military efforts overseas. Sometimes it's because they saved and made those tough choices that have helped make this country great. But, Mr. President, I believe that if this Congress acts to take money from Medicare, which is insolvent, and doesn't use those cost savings to make Medicare more solvent, we will be contributing to the fact that there's no doubt in my mind the leadership, the political leadership that exists today in this country is undoubtedly the most selfish political leadership that this country has ever seen. We're witnessing that today. We're a part of that today. And it's my belief if we continue to throw future generations under the bus, which is what we're doing with legislation like being proposed today. We are throwing future generations under the bus to score a political victory that we all know is not paid for. The wrath of the American people is going to come upon us, and it should. Thank you, Mr. President.